As hospitalizations climb from COVID-19, many healthcare settings are in need of support to free up critical care beds. As medical reporter Liz Bonus explains, some of that care comes from providers who are trained to help transition patients from the hospital back to their homes.
Transitional care units have been used for years to help patients go from the hospital to home, usually where rehab is needed, say for something like a hip surgery. Now, however, these transitional care units are providing rehab and much more as COVID patients recover from the virus and its complications. They also are helping to reduce hospital admissions from patients who come into the emergency room. For example, at Ohio's CareCore Health, they have units now that care for COVID patients that need isolation, so they're not with other residents. But they also have what they call transitional units for non-COVID care. The staff in those units stay in those units and are tested regularly. That limits exposure to others as well. Here's Andrea West, a nurse and CareCore's Corporate Director of Business Development.
We're admitting more and more patients from the local hospitals. Local hospitals seem to have a growing census, and we are helping them. We're actually directly admitting patients from home with the proper things that we need, as well as admitting patients from the local emergency rooms. So as long as we have a negative COVID test, we are providing safe and great care for them.
A portion of that video provided by CareCore. Now we know for those who do need critical care, hospitals have makeshift contingency plans if they do need to expand. These include setting up tent hospitals, including convention center beds and things like that. But being able to transition those who need it to other places, such as these long-term care facilities, just one more way to lighten the burden on healthcare workers who really need those beds in the hospital. I'm medical reporter Liz Bonus. We'll throw it back to you.